Hello, everyone, and welcome to this high yield review of Toronto notes. I'm making this series of video to help you review the Toronto notes. For times when you can't sit down, to read through, you have these that helps you review the actual text of the Toronto notes. I also try to make it engaging by explaining a bit, so I'm not just reading it through. And I have included some questions at the end as well to help you test the key concepts in the review. And so we're still in the pediatrics section of Toronto Notes and the common complaints subsection of that. And today's topic is crying or fussy infants. Um, so let's get into it. What are the common etiologies for crying infant? It could be functional, like if the child is hungry, hasn't slept well, it's just irritable. It could be colic, of course, and it could be due to trauma, illness, or hair tourniquet. And what do parents tell you or caregivers tell you when they come into your office? They describe they describe that this child has been crying for a while. And as the physician, you want to get into the history by asking about their baseline feeding pattern, the sleeping pattern, and the crying pattern. It's also important, like we listed out in the etiologies, to ask about infectious symptoms. Has there been fever, tachypnea, rhinorrhea, or any ill contact, like a sick sibling? Is there been any feeding intolerance, which could help you begin to suspect a gastroesophageal reflux with esophagitis, any nausea, vomiting, any diarrhea, any constipation? So when you inquire about that, it could give you some insight into some GI conditions. It's also important to check for physical injury and to check on their fingers and toes for a hair tourniquet, because that seems to be quite common. They could have some hair caught around their fingers or their toes, leading to pain, a localized pain that the caregiver hasn't noticed. All right. It could also be due to recent immunization, like a vaccine reaction. So, have they had vaccines in the past few days or weeks? And have they had any medication as well? Because it could be due to a drug reaction, including maternal substances that is taken during pregnancy, because some substances lead to a neonatal withdrawal syndrome. And so, is the child experiencing withdrawal or substances that may be transferred via breast milk? All right. So, when a caregiver is given inconsistent history, or there's a pattern of numerous emergency department visits, or difficult social living conditions like parental substance abuse, precarious living circumstances, in the mind of the physician, this should raise concerns for maltreatment or non accidental injury. So it doesn't confirm anything, but it's so important to assess the situation for that. Now, it's also important to consider a broad array of possible underlying causes, including meningitis, sepsis, respiratory distress, and constipation, like we checked in the history. All right. So that's that about what has been outlined in Toronto Notes. And I'll just run through these practice questions because I find that it helps to retain some of the key concepts. But if you do not feel that this is necessary, please feel free to move on to the next video in the playlist. Question one: a 6 week old infant is brought to the emergency department because of persistent crying. The parents report that the infant was previously feeding and sleeping normally. So, normal feeding and sleeping pattern. But over the past 24 hours, the infant has become increasingly irritable and difficult to console. And there's also decreased feeding. On further questioning, the physician learns that the infant has had several previous emergency department visits for similar concerns, but the parents provide inconsistent explanations for the episodes. Which of the following is the most important concern that should be considered in this patient? Of course, you know that the answer here is C. Question 2. A 2-month old infant presents with a sudden change in crying pattern. The infant has been crying continuously for several hours and is difficult to console. The patients deny, the parents deny fever, vomiting, diarrhea, or any respiratory symptoms. Which of the following should be specifically examined as a potentially reversible cause of the infant's distress? So, everything here should be examined. Tympanic membranes, but when they write only, it's obviously not correct. So it's great to look for otitis media, to look for pain in the hip or pain in any joint or any bone. It's great to look at the oral mucosa. It's great to look at the anterior fontanelle. And it's also great to look at the fingers and toes for air tourniquet. Yeah. All right. Question 3. A 3-month-old infant is brought in for excessive crying. The physician begins taking a history. Which of the following is the most appropriate initial approach to characterizing the infant's symptoms? And the answer here is B, of course. So it's important to establish before this started, what was the baseline feeding like? What was the baseline sleeping like? What was the baseline crying like? And how has that changed? Question 4. A 5-week-old infant develops marked irritability and feeding difficulty. The infant's mother reports taking several medications and substances during pregnancy. The infant is currently breastfed. Which history is particularly relevant to determining a potential cause of the infant's symptoms? Mother's dietary preferences, maternal substance use during pregnancy, and substances transferred through breast milk, father's medical history, number of prenatal ultrasound, maternal exercise during pregnancy. Of course, the answer here is B. Good. All right. Question 5, very quickly. A 4-month-old infant is brought to clinic because of persistent crying. The parents report that the infant has recently developed rhinorrhea and increased respiratory rates. Several family members have also been recently ill. Which additional history is most relevant? The answer is A. All right. Question 6. Moving on quickly, a previously healthy 7-week-old infant presents with a significant change in behavior and persistent crying. The infant appears unwell on examination. Which of the following diagnoses should be included in the broad differential diagnosis of a seriously ill, persistently crying infant? What's your answer to that? The answer is E, all of the above. Last question here. A 2-month-old infant is brought to the emergency department for unexplained crying. The parents live in precarious circumstances. There is a history of parental substance abuse. The physician notices that the history does not fully match the infant's clinical presentation. What's the most appropriate clinical approach here? The answer is C. Consider the possibility of maltreatment or non accidental injury. Thanks for going through this part of Toronto Notes with me. Um, please subscribe to the YouTube channel if you haven't already done so. And I'll see you in the next video for more review of the Toronto Notes.